Hello, and welcome to the Sound Relief Podcast. Today, I'm talking with Allie Treseder. She's an audiologist and clinical director of operations for Oto, and we're going to talk all about that today. Before we dive into your career, Allie, what do you want someone struggling with tinnitus to know right away, right from the top? What would you say to someone who is really struggling with tinnitus?
I think two big things. One, you're not alone. It's common, and that there are true solutions, evidence-based solutions out there that exist. And then the second thing is stay off of Google. Google is going to tell you so many wrong things about how to get help, how to get relief, and most of the time they are not correct. So visit an audiologist who specializes in tinnitus. Those are the two big things.
Awesome. 100% agree. So I want to know more. How did Dr. Treseder, how did Allie become an Army audiologist? Because audiology is very specific. And then an Army audiologist on top of that is even more specific. So can you share your background, how you got to that point?
100%. I've had kind of an interesting path to where I am now. I always felt a drive to join the military. I mean, even since I was a kid. And as I was going through high school, I thought about joining after high school. And, my mom said, please just go to college first. And, I went and I fell in love with audiology actually, because I was a resident assistant in the residence halls, and our custodian was a member of the deaf community. And I still remember he used to come to my door and we would write back and forth because I didn't know sign language, just to chat. And a resident once said to me, he's really not nice to me. I say hi to him, whatever, he ignores me all the time. And so it clicked. There was this thing in my mind of, oh my gosh, communication difficulty doesn't even cross your mind as something that could be happening here. And so, that kind of put me on the audiology track, but I still had this desire to serve. And so, as you know, we have essentially the end of our doctoral program is a residency or a fourth year externship that we do. And there was this opportunity for active duty military. And I kind of just said to myself, look, I'll put my hat in the ring. I'll interview. I'll do everything I can. If I get it, that's a sign that, it was meant to be. If not, and so luckily I was accepted. And I got to tell you, being an Army audiologist is incredible. It's a really incredible experience. You learn a lot, you see a lot. And that's actually what made me fall in love with tinnitus to begin with, was Army audiology.
Yeah, I could see that because, when you think about service members, what are the most common hearing issues that you saw as an Army audiologist with service members?
Tinnitus, for sure. So, it's crazy to think, for service members, for all of the different injuries, disabilities that they can claim, tinnitus and hearing loss are the number one and number two VA disability claims, full stop. It is insane how many people leave there with tinnitus or hearing loss. And not only that, when I did my fourth year, I was at Walter Reed. And so you would see a lot of really complex cases. And so you're also seeing, and you've probably seen the emerging research looking at head injuries or blast exposures that even if they don't affect your peripheral hearing system, or, can you press a button when you hear a beep, it is impacting their ability to understand speech, so to process speech. And so those are the things that I saw the most, was noise-induced hearing loss, tinnitus, and really an issue with processing complex stimuli.
So, Allie, many clinicians in audiology shy away from tinnitus. Why did you decide to lean into it? What made you say, you know what, I know maybe there's not a lot of people specializing in tinnitus right now. What made you decide to take that as a focus for your work?
Yeah, I can tell you the exact moment I shifted onto that path was during my fourth year at Walter Reed. I was in the hearing booth with a soldier. He had just come back within the last month from overseas, and he had other injuries that he was being treated for, but he sat there in my booth and he had his head down, and I can picture him to this day. And he said, "This is it for me." Essentially saying, I can't find peace or quiet in my own head. Yes, he's dealing with, these images of things that happen, downrange and all of that. But it was something about having no ability to find peace because tinnitus stole that from him. And I remember I walked him down to behavioral health. We walked together down to get him the resources he needed. But it was then, and I almost get emotional talking about it because it impacts patients, it impacts people so significantly. Their ability to enjoy life, to connect in their environments, all of that, the things that give our lives meaning, it gets stolen from them because they can't find peace internally. And so it was from there that I said, there is a real need here for people who need help, who are suffering from tinnitus. They need someone to hold their hand out and say, look, I got you. We're going to work through this together. Because there are a lot of evidence-based approaches. And like you said, there's not a ton of people who go for this. So why not me? And so that's my pathway to tinnitus.
Yeah. Yeah. That's a great, great story of what led you to tinnitus and specializing in tinnitus, because it's always that desire, I think, that we have to help others, right? And to really not be the one that is discouraging and unhelpful. I mean, up until that point when he met you, was the sense that he was hopeless? Because I feel like that's a common feeling we see with tinnitus patients. And so, how did you steer him in the right direction when he felt like his life was stolen from him?
Yeah. Well, truthfully, a lot of the rhetoric that you hear on social media, that we hear it a lot in the military, almost in a joking way to make light of it, is, the army issues you tinnitus, right? It's just everyone's going to get it. There's nothing that can be done about it. And I think it's that key, is that the message that nothing can be done is so strong. It's so overpowering that people are just left to kind of have to accept it, deal with it. And so with him, and along with many of the patients that I still see, it's educating them about what does exist. There are so many, we call them tools in our tinnitus toolbox, right? We have tools in the toolbox. There are so many of them that when we spend one-on-one time with patients and we can peel back the layers, of their specific situation, we can use those tools in really effective ways. And so for him and all of my patients, it's about peeling back the layers and educating accordingly. So yeah, that's my approach.
Yeah. And tools is such a great word, right? We always talk about having the tools in the toolbox, and that gives people hope, and they realize that they can help themselves, right? When you give them an effective tool. Have you seen people, this is a common question we get all the time, right? Have you seen patients that can achieve peace and quiet again and get that tinnitus under control? Have you seen that yourself as an audiologist over the years?
Many times. Many times. And it's interesting because no one patient takes the same path, right? That's why it's so important that we take the time and we sit down with them and we understand the complexities of their particular experience. But I have many patients who have gotten to a place, we never really use a term like, oh, we've cured tinnitus or that sort of thing. We manage it. And I've worked with a lot of patients who are at a place who say, I'm not even bothered by it. It's that experience of, think about when you plug in a refrigerator for the first time and you hear the buzz of the refrigerator. You hear it, you decide it's not important, you forget about it. I mean, when's the last time you heard your refrigerator make a noise? Same sort of thing, is that we can train the brain to genuinely declassify that sound as important, as threatening, and it does genuinely drive down the volume, the intrusiveness, the impact on quality of life. And so, um, like I do, it's incredibly rewarding to peel back those layers and get there and help people find peace again. It's really we're lucky to do what we do, for sure.
Yeah, no, I totally agree. And then what kind of made you decide to steer a different direction? So outside of maybe traditional clinical care at the VA, what made you decide to look at other ways that you could impact tinnitus patients like you are today?
Yeah. Honestly, it was I think this desire to be a part of creating another tool in the toolbox, right? Because what I found, back when I first joined the military, is that I didn't feel like we had a lot of tools, right? There was research out there to support the potential for tools, right? But nothing that we could really actively use in clinic that felt attainable, right? For example, like therapy-based treatments, that wasn't something that I could provide to most patients. And so I really wanted to be part of a team that could build tools to help my colleagues, my fellow audiologists, help these patients. Because I know what it's like to wish I had more tools. And so I know you do as well. So it was just this desire to kind of be part of something bigger, similar to my desire to join the military, I think, is to have as big an impact as you can, help as many people as you can, be part of a team. That's what drove me in this direction. And I've just been honestly fascinated by it. The emerging technologies, the emerging research. We're seeing a ton of emphasis on tinnitus research now, which is amazing. We've needed it for a long time. So yeah, this side is cool. And I get to have conversations like this, where I wouldn't otherwise be able to have them. So
Yeah, no, and having the biggest impact possible is always a great thing. You can, right, you can influence and help more people that way. So that's a great thing. So how did you find, let's talk about Oto. How did you find Oto Health? How did that all come about? And can you tell us a little background about how Oto was started, all of that good stuff?
of course. Yeah, funny enough, one of the co-founders, Dr. Farrar Edmond, I had known him for a few years, because, of course, being on the industry side and wanting to add more tools to the toolbox, I'm always looking at what else is out there, what's emerging. And so Oto had been my radar for a number of years. And so it was truly by luck that I ended up here. They just happened to be hiring at a time where I was ready to look at something new. The reason I joined Oto truly is because of their founding story and where they've invested their time and energy. So our two co-founders, amazing people, Ed and George, they're two physicians. They were military physicians in the UK. And so they know what it's like to see patients. And George actually got tinnitus, really bad tinnitus that impacted his quality of life quite a bit. And so, as physicians, he's friends with Ed, said, okay, what is best practice here? Let's look at the research. Where is it leading us? How do I fix this? And so what he found is that best practice, what a lot of the clinical guidelines recommend, is what everybody with tinnitus should experience is CBT, cognitive behavioral therapy, right? So he said, great, sign me up. Well, unfortunately, in the UK, at least at this time, there were only 7 in the entire UK, 7 therapists qualified to work with tinnitus patients. So access to care, there was none, right? And so Ed and George kind of looked at each other and said, there's got to be a better way. There has to be a way. And so that's when Oto was born, really from a need of increasing access to care. If we're saying that, hey, this is the most research-based approach, why is it not attainable? Let's make it attainable. And so that's what they did. And, they really grew in the UK. And what I love about them is I think part of it's born from their providers themselves, but also part born from they've also experienced tinnitus, really bothersome tinnitus. every decision they made was to improve the experience and the outcome for the patients. And so all of the research that's been done, there's a third-party study done by the University of Cambridge that's in publishing right now, just showing the incredible impact that this program has, and how effective it is. So I saw all of this happening, and when the position opened up, as they began to grow more here in the States, poor Ed, I pretty much reached out to him and said, please hire me. I could not have been more in his face, which he's British, for a Brit, maybe came on too strong, but I'm here now. Oto's an amazing place to be.
Let me summarize a little bit and see if I'm missing anything, because I love to kind of wrap my brain around their story too. It's so fascinating. So Oto was started in the UK,
Mm-hmm.
2 physicians, both experiencing tinnitus, both well aware that cognitive behavioral therapy is proven effective, one of the most effective tinnitus treatments out there. So they decided to develop a whole program called Oto today, right? And Allie, will you then maybe elaborate on that a little bit more? Like, who is Oto intended for?
Yeah.
How does it work? What is it exactly, Oto specifically?
Good question. So Oto, kind of in a nutshell, it is a cognitive behavioral therapy-based program that's facilitated through your smartphone. Because what's the most convenient thing? I mean, who doesn't have their phone? Anybody watching this might be watching it on their phone, right? Very convenient. And so what it does is it follows what the evidence shows in terms of delivering CBT, the exercises, proven to help people manage tinnitus, to reduce tinnitus. And it slowly peels back the layers over the course of 3 months. So it's a 3-month program. And it's once a day, 5 to 10 minutes. I'm going to call it there's a core CBT program that they go through. In addition to that, there are some additional modules. Like I know, nobody's tinnitus is the same, right? And we actually do, we call it TFI, Tinnitus Functional Index. What that questionnaire does is really help show the unique areas that, where a person has difficulty. So for example, sleep, quality of life, intrusiveness, feeling of control. We can look at all of those individual pieces, and we have additional content within the program specifically aimed at, that particular space. So sleep is a big one for patients. I have very few patients I've encountered with tinnitus who don't say, at the end of the day, it's roaring in my ears, and sleep is tough. And so we have content specifically around sleep. And so it is a means of delivering cognitive behavioral therapy, prescribed by an audiologist. It is, you have to be seen by an audiologist first. But from there, they can do it at home, right? They can do it where it's comfortable for them. In this study that they just did with the University of Cambridge, they actually showed that the most common time that patients are accessing the app is between 10 p.m. and 1 a.m. The time that we know people are struggling the most, which is really interesting. And so it's not only providing access to care, it's providing convenient access to care, right? So it fits within their lifestyle. It's a pretty incredible tool that we have now to deliver this therapy to patients.
Yeah, it is. I'm a big fan, as you know. We're using Oto a ton to help our tinnitus patients. But can you tell me a little bit more about, for the patient that hasn't seen, or maybe has seen, some of the past apps that have come and gone, how is Oto different than some of the stuff we've seen on the market before that maybe just play, sounds and try to mask tinnitus? And I just want to make sure people understand, like, Oto is so unique and different. So how would you summarize how Oto is different than other apps that have come prior to?
Oto's goal is to address really one of the main root causes of tinnitus, right? And it's that emotional distress. And so actually the AAO HNS guidelines what they recommend in terms of who is a good candidate for CBT. And they state it very simply. It is anyone who reports, and I quote, tinnitus related distress, right? So if you are bothered by tinnitus, you are a great candidate for CBT. And so, I do think that, different sound, I call them sound therapies, but, masking sounds, they can have their place, right? Especially as patients are first learning how to cope as they're going through, their CBT process or, any of the other, treatments that they're going through. A lot of sound generators, all they're doing is I'll use the word you use, they're masking it, right? We don't want to simply mask it and, introduce another sound to block out a sound. We want to get to the root of the issue, so that people aren't stuck listening to masking sounds or that sort of thing in the long term. So that's what separates us. It is a truly evidence-based approach that's delivering true therapy, not just something that's going to mask it, but true therapy to address, the underlying issues going on.
Yeah. Yeah. And you were talking about the Cambridge study that's in publication now or soon to be released, right? And what I found so fascinating, I can't remember the exact numbers, which I'm sure you do, which is why I want to ask the question. So the study compared in-person CBT therapy and the success of Oto compared to in-person CBT therapy, which, by the way, most people realize CBT therapy, unfortunately, isn't typically covered by insurance, and it's typically pretty expensive. We're talking like $250 a session is what I hear from some of my patients. Maybe $150 to $250, right? Maybe there's a range there per session. But what did this study really show when it compared Oto to in-person CBT therapy?
Yeah, it showed that it is just as effective, and it's incredible. And I mean, truly, in my opinion, groundbreaking in terms of evidence-based care in tinnitus care. It showed it compared, and again, it was done by the University of Cambridge. It was it was a grant provided by the UK government to the University of Cambridge because they want to improve access to care. And so they looked at, okay, if we're saying that CBT is the gold standard here, we've got decades of research on CBT, right? All of that research is looking at CBT as we know it, in-person therapy. They wanted to say, okay, if we're going to increase access to care, we need to make sure that this care is, of equal caliber to everything that's already been researched. And so they compared one-on-one cognitive behavioral therapy to the Oto program and found that they were equally as effective and very significant clinically and, of course, statistically significant decreases in their TFI, meaning their tinnitus got significantly better throughout the course of treatment, which is it's incredible. It's amazing.
Yeah. Yeah, it really is. And, I think people might question, only 5 to 10 minutes a day. How is that really going to be effective? But I've gone through Oto myself. I know you have too. And I think, patients just need to realize that we all have 5 or 10 minutes a day where we can be learning these concepts, absorbing this material, incorporating it into our daily life right away. And because we know, unfortunately, most people are having shorter and shorter attention spans, right, these days because of all the screens and technology we have in front of our face all the time. 5 to 10 minutes, anybody can do that, right? But it just fascinated me that 5 to 10 minutes a day could be just as effective as in-person therapy. But it's so exciting to see that because most people are busy and they don't have necessarily the time, nor they want to necessarily make the time to have to go to a therapist's office and sit through a whole session and, wait to see results. I feel like this is such a better way to implement the strategies quickly for bothersome tinnitus, see results quickly for bothersome tinnitus, which is motivational to keep going, to keep at it, right? And so, yeah, it's just great. It's so exciting to see these kind of studies come out to prove effectiveness, because that's always on, I think, people's mind, right? Top of mind. How effective is this? Is this really going to work for me? So,
yeah.
No, I was just saying it was super exciting that you can, in 5 to 10 minutes a day, right, get the same level of effectiveness as in-person therapy, because nobody has the time, or very few people really want to make the time to go see somebody, to do in-person therapy, to, have that whole chunk of their day versus 5 to 10 minutes and to see the same effectiveness. It's like, whoa, uh, people are busy, and, time is money these days. So, yeah,
100%. Yeah,
yeah,
it's
yeah.
with the goal being increasing access to care, Oto hit the ball out of the park on that one.
Yeah.
It's convenient, it's
Yeah.
easy, and anyone can access it through their audiologist.
Yeah. Yeah. That's great. And I get this question a little bit in the clinic, and I honestly don't know the answer, so I'm excited to ask you. But so Oto started in the UK.
Mhm.
So it's only been in the US, the past year? Is that right?
Yeah, yeah.
20, about a year. And so how long was it in the UK before coming over and getting FDA approval in the US?
Yeah, about 5.5 years. So they put, I mean,
Wow.
this was not something, like rushed to market or anything like that. And quick caveat, we are in the FDA process right now. And that's a choice. So this is, when it comes to therapies, they can be looked at as wellness devices, but we really wanted to take it that step further, and really have someone sign off on it, because the FDA is really great at letting patients know, hey, you can trust this, right? And it's really important to us that, I mean, both our providers and patients, they're trusting us with something big, right? I always think about that patient that was sitting in my booth that we walked down to behavioral health together, right? And I want that person to trust us. And so that's as we're going through that process, that's at the forefront of our minds. And so, but they have put in the time and the research to make sure that by the time it got to us here in the States, it was a very well-oiled machine, so to speak. It's really well done.
Yeah, and I think that matters to patients, that there's that history. It's not like this is a, pop-up overnight success that's going to be gone tomorrow. So just knowing that history, I think, puts patients' minds at ease too.
For
That
sure. I
it's
mean, you
that,
don't know this. Like, Google tinnitus cure. How many things are going to come up? I actually just read a study not that long ago about the information available to patients online about tinnitus. And over 50% of the sites that come up in the top 20, and they looked at 20 different countries, over 50% of those websites are commercial. They're all trying to sell you something, right? They're not truly educating patients on how do we get good care, what is evidence-based. And so I think, even more than other areas in our profession, tinnitus care, trust is probably the most important thing we need to build with people. That they know that they can trust when they come to us, they are getting really good quality evidence-based information, right?
yeah, so important, so important. And, from what you've seen so far with patient engagement with the Oto program, what do you think you're most excited about with this program? Anything that you're just super excited to see that's different?
Honestly, we get notes from patients all the time that, whether it be through providers, sometimes they go onto our site. We've got a little icon in the bottom right. We can kind of like type into us, and we all see it. For the first time, and I've been in tinnitus over a decade. For the first time, I am seeing just overwhelmingly that patients who go through this program under the supervision of an audiologist are having these amazing outcomes. And I think like that's what excites me, is we've been dying for this in our industry as audiologists, to have something that we can trust to give to our patients. And I'm most excited just to see this continue to grow, really, to allow more patients to experience this, give more patients the excitement, so much excitement that they want to write into us on our website just to say thank you, right?
Yeah, it's great when you get that positive reinforcement from patients actually using it where it's working, it's changing their lives, and it's super empowering to see that happen on a daily basis. So I agree with you. And we've been talking a lot about, through an audiologist, you need to get the Oto program through an audiologist. Why did Oto decide to go with that pathway versus, maybe something else like going through psychologists or
Mhm.
family care doctors or some other
For
route?
sure. Well, I think inherently, as audiologists, when it comes to hearing related issues, tinnitus, we really are the experts in this space, right? And I've heard it from patients before. They'll come to me and say, and no fault to their primary care physician, they have to know everything, right? But they'll come and they say, yeah, my primary care physician said they weren't really sure what could be done, or maybe they thought nothing could be done. And it's an education thing, right? And knowing that we can work with audiologists, make sure audiologists, right, feel very comfortable with, they're tinnitus experts, right? They specialize in tinnitus, and knowing that they can deliver Oto to patients that would really benefit was really important to us. That and getting a full audiological evaluation is incredibly important here. There are so many different things that can cause or exacerbate tinnitus that are related to the overall health of your auditory system that truly you need to go to an audiologist who specializes in tinnitus, who is going to do a full tinnitus eval on you that includes hearing and very specific tests for tinnitus to better understand, what is going to work for you. We always talk about these tools in the toolbox. Well, the only way to know what combination of tools is the right combination for you, you have to have somebody who's going to peel back those layers. And that in our space, that's audiologists.
Yeah. And I think, sometimes we forget what we don't as audiologists, but I think sometimes most people forget how complex, right, the auditory system and the brain that is really generating the tinnitus in most cases is. And so you're right. If we don't have really extensive understanding and experience and knowledge about, what in the auditory system could be contributing to tinnitus, that maybe there is medical intervention that could cure it. That's pretty rare, as you and I both know, but the what ifs, right? We've got to get through those what ifs, I think, and really gain a patient's confidence that we're not overlooking anything. There's nothing here going on that is threatening or harming you. It's just, in most cases, right, we've had some maybe noise-induced damage to the auditory system. Maybe we have some aging process on top of that that's resulted in some changes along the pathways. But we need to know that, and we need to know that, like you said, forward and backward, if we're going to get the right tools to the right person. And I love how you say that. I mean, Oto is a fantastic tool that works well for a lot of people. But first, before we give them Oto, we want to make sure we're not missing anything, right? So I think it's
Absolutely.
just so important for people to
Absolutely.
understand that. Yeah.
I always say that for us as audiologists, the most powerful tool we have of all those other tools is the education component, right? And so I teach courses all the time to patients, and I spend an entire hour talking about the behavioral changes you can make that can actually impact your tinnitus. And in some cases, patients take medications that are causing their tinnitus, right? With us talking with their primary care, a simple switch of the type of medication can sometimes really help. But lack of sleep, I people typically don't like to hear this one, but nitrates and nitrates. So things like people who love sausage or eating different types of meat, red meat, um, alcohol consumption, those sorts of things, smoking. There are all of these things that can make tinnitus worse, that if you can kind of change your behaviors around them, that on its own can really help your tinnitus. But it takes somebody sitting down with them to really peel back those layers again and and identify those behavioral changes that they can also make. So yeah.
Right. And it's, I know in this day and age, right, people want a quick fix. They want a magic pill, or even, I mean, I'm surprised because I don't like surgery, but some people are like, isn't there a surgery to fix this? Isn't there a prescription? And I think because there's no pill, right? There's no magic pill, there's no magic surgery. That's maybe where people get down this, negative spiral of nothing can be done. But that's
Mhm.
just not true, right? Just because there's not a pill or there's not a surgical route doesn't mean we don't have, like you keep saying, evidence-based tools.
Yeah.
Oto's another one that we're just so excited to add to the toolkit. So
Yeah.
along those lines, what do you think is the biggest misconception people have about their tinnitus symptoms?
That they just have to live with it. I mean, we've kind of touched on it, but the idea that there's not things that they can do to kind of help with their tinnitus, that's the biggest misconception. And I don't blame people, because again, we just talked about, when you Google tinnitus cure, all of that nonsense comes up. Because let's face it, people know that tinnitus patients are often very desperate for a quick solution. And so it's very easy to say, hey, take this pill and monetize it, right? And truthfully, nobody comes to us with their tinnitus thinking nobody wants a therapy-based treatment. Of course they want a pill. That's when they go to the doctor for their leg that hurts, right? They may get a pill to help with that. Nobody wants to have to put in the work, right, to get better. And it's kind of like, a good friend of mine is a physical therapist. He always talks about these patients come into his office, they haven't done any of their exercises, and yet they want to get better. They want to get better. But it's that piece of taking the time out of your day, and in this case, 5 to 10 minutes a day, and really investing in progressing, right? Getting better. That's really important. And let's face it, nobody wants to have to do that. It'd be much better and much more relief for us just to be able to take a pill. And I always say this, if there was a pill out there that really worked, you'd know about it, because all of us as audiologists would be shouting it from the mountaintops, right?
Right.
Yeah. So I wish I could tell every single tinnitus patient, do not believe that there is nothing that can be done. Do not believe you have to live with this, because that is not true.
Yep. And, I think the hard part sometimes, and maybe you could share how you explain this to patients, because I feel like sometimes we have very literal, right? Some minds, some patients that we work with have very literal translation of this, and they feel like, I can't just talk myself out of thinking about my tinnitus. And so if cognitive behavioral therapy is just talk therapy and you're trying to convince me that my tinnitus is a good thing, it's not going to work for me. And I try to stop and say, well, our subconscious, what we feed our subconscious brain, right? Sometimes it's our lower brain that's controlling our higher brain, and you don't have control over that subconscious all the time. So what we feed that lower brain, right, what we give that subconscious brain is what becomes our reality. So why not try to be open and positive about something new like CBT for tinnitus, and see if it doesn't just work? Like, don't go into it with a negative mindset. Be open to rewiring, retraining that subconscious lower brain with these very specific activities that go, like you were explaining, in a chronological order on purpose for a reason, because we know if you do it in this order, it works. But is there anything else you add to that when you're trying to explain to someone that, it's more than just your higher level brain dealing with this? We also are trying to rewire kind of lower subconscious level thought as well. How do you explain that to people?
Well, I think inherent to kind of the problem there is that it feels incredibly intangible, right? And the way I always think about it, because I'm one of those people, and look, I think everyone can benefit from seeing a therapist for any number of reasons. I'm one of those people who, I'll hear of these things, even unrelated to tinnitus, but ways to manage emotions, and it feels kind of frou-frou to me, right? And I completely empathize with that knee-jerk reaction of like, oh, I'm not just going to be able to, tell myself like, oh, be happy, and then be happy, right? And so it took me a long time in my own personal life, to even come to terms with the idea of how much the inner workings of our brain and not necessarily our conscious mind, but how much that impacts, our lives. A really interesting book, if you haven't read it, is called The Body Keeps the Score. Fascinating. Yeah, I had a feeling you might have read it. It's fascinating. And it talks about a lot of this, how your body over time changes in response to all these things you experience, right? And it's an example I use pretty often about how our subconscious mind really impacts, your stress and anxiety and all of that. Think about it. You're a caveman. Sounds very silly, but bear with me. You're a caveman, right? All of our systems, our biological systems exist to keep us alive, right? Back in caveman days. So I'm in my cave. I'm making dinner, whatever it is cavemen do in their caves, right? And suddenly you hear rustling outside your cave. Is that a bear? Is a bear going to eat me? I take a look. I don't know. Nothing there. But, I go back to doing what I'm doing. But you can bet your butt my brain is continuing to check in. Is there a bear? Now maybe I hear a stick break or something like that. I'm continuing to check for it. My brain is, because it wants to keep me alive, right? Anything that my brain interprets as a threat, it's going to keep tabs on, right? And so that is what happens with tinnitus is you hear it and you think, don't like that, right? And so your brain, because of our biology and the way our brains work, it's categorized it as a threat and it's going to keep checking in with it. Oh, it checked in, it heard it. The threat's still there and it's going to continue to feed in. And so I always talk about, again, I go back to the fridge analogy, right? We didn't categorize that buzzing of the fridge as threatening. So, we don't hear it anymore. You can genuinely, if you commit to actually doing the exercises within the Oto program or within CBT in general, if you commit to that, you are fully capable of breaking that connection of I heard it, it's a threat. And that is what drives it down. And so I always just try to bring it back to our bodies are always looking for threats. They're looking for the things that we don't like to focus on them. So we stay away from them and we stay alive. So it's really not our faults that that this happens, that we perceive tinnitus this way. And so that's kind of my approach. But I get it. It feels, again, intangible. It feels touchy-feely. And frankly, when I first started my journey many years ago in therapy-based treatments, I thought I knew better. I can listen to a podcast and learn everything I need to know. Like I already know what you're going to say. So it took me some time, but I am the biggest believer in it now. I've seen the data.
Me too. 100%.
Yeah.
So if we were talking to somebody today who's really struggling with their tinnitus, maybe he's had tinnitus for a long time and it just seems to be in that vicious cycle of getting louder and more invasive and more intrusive, what would you recommend they do as a first step today?
The only time I'm going to allow them to go on Google is right now. Google audiologist who specializes in tinnitus near me. Some variation of that. Start with an audiologist who specializes in tinnitus. And I really emphasize specializes in tinnitus because, like any medical profession, we all have our interests, right? For me, of course, that was tinnitus. For you as well. Some really like balance. Some really love, hearing aids and hearing. Look for somebody who is passionate about tinnitus care, provides full tinnitus evals, and start there. That's the only thing they're allowed to Google. Stay off Google. It's going to convince you have all these things wrong with you, or you need to buy these different pills or whatever to find relief. But that is not the case. Go to an audiologist.
Yes, please, 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 please. We beg of you, right?
We
go
beg, please.
Go to an audiologist that specializes in tinnitus. So important, so important. And Allie, what gives you the most hope about the future of tinnitus care? Anything on the horizons or anything that you just are excited to think about in the future?
Providers like you. Truly. It's, I think it's one of the reasons I love being on this side, on the industry side of things, because I get to, 10 years ago, it felt like there wasn't much out there for tinnitus patients. I didn't know quite where to go. And now I get to work with providers like you every single day who want nothing more than to give patients like my patient in that hearing booth during my 4th year who was suicidal. There are providers out there looking to take that person by the hand, and I get to work with those people and to see your passion. I'm almost getting emotional. Like, it is incredible. So I'm just so excited to see the passion in our industry grow to help people who need it.
Yeah. Thank you. Thank you. Thank
Yeah.
you for your kind words. And yes, I agree with you. We're always, trying to find other audiologists who are just as passionate as we are about helping people with tinnitus and all the other associated things that go with it, the hearing loss, the sound sensitivity, the other things that tend to creep in. So
Yeah.
I agree. I think the future is just going to continue to get brighter and brighter because we're understanding more and more. And like you said, there's more and more research coming out. There's more and more understanding, and so I think the future is bright. We just have to see also where technology takes us, right? So
Oh, I can't
um,
wait.
yeah,
I'm just so
yeah,
excited to see what we come up with next that's evidence based and helps patients. Can't wait.
me too. So, if you could leave listeners with one final thought, maybe something we didn't cover or something you want to emphasize again, what would that be? Kind of a final thought about tinnitus.
That's a good question, right? How do you sum up the conversation? And truly, I really think it's just there are people out there like you, like myself, who have our hands outstretched, saying, "Come with us, we got you." I just want people to know that we got them.
Yeah. No more hopelessness, right? No more going home after being told just live with it and feeling like their life is over or ruined. It doesn't have to be that way, right? We can partner with them, and with tools like Oto, we can really make a difference. So,
Yeah.
thank you so much for
Oh, thank
being
you.
on the podcast with us today and sharing all of your experience and your background and your knowledge. It's so motivational to work with people like you when we're of the same mindset, right? We share so many common experiences, so it's so great to talk
Yeah.
to you. So thank you for your time, your expertise, your knowledge. We really appreciate you taking the time to talk with us today, and I'm sure we'll be in touch and have even future discussions about what Oto is up to and what other things we can do to help more people in the future. So thank you.
I cannot wait for those conversations. Thank you for having me. And I
Yes.
know that you and I, as we do, will be in touch probably very shortly after this.
Yes. As always, yes.
As always.
Thank you. Uh-huh.